Good evening and welcome. We are so happy that you have joined us tonight for this joint event between two programs at the School of Professional Studies here at Columbia University. I'm Cindy Lott. I am the Academic Director and Associate Professor of Practice for Nonprofit Management, and I am so glad to be joined here this evening with my colleague and friend, Dr. Bob Klitzman. Our program, who is the director of the Bioethics program, our programs together had been thinking for some time that it would be great for us to be doing a joint program this evening because we want to address a number of issues at the intersection of nonprofits and healthcare. As many of you are well aware, you may already be working in one of these sectors and be thinking about how you can make the crossover to the other or how you can combine these interests. We have seen, obviously, in the last year and a half, 2 years, the impacts of COVID, the impacts of equity discussions, that healthcare and nonprofits have even more intersection than ever before. Historically, healthcare in the United States, over 40% of it is delivered by nonprofits. It's an entire area. It's a field of growth for careers, and it's also a field of growth for research, which Bob and I both do, in thinking about how we approach these issues from each of our perspectives and work with colleagues with different competencies within nonprofits and within healthcare. We have a fantastic panel here tonight, and Dr. Klitzman is going to be our moderator for the evening. I will step back and actually become one of the panelists later this evening. We want to thank you for joining us. We know you're tired on Zoom at the end of long days, but we are here for a great and robust discussion tonight, and we hope that you will enter questions into the chat that Dr. Klitzman can pass on to us. So with that, I'm going to turn it over to Bob. Thank you so much for working together on this event on really, really important and relevant and timely issues tonight, Bob. Thanks.
Well, thank you, Cindy. I really appreciate the introduction, and it's wonderful to be with a wonderful panel this evening. And thank you all, those of you who are watching us, for joining us. And we see this as a very interactive session. So please feel free to ask any questions in the chat, and hopefully we will have time to answer all the questions. And we have some wonderful panelists who I'll be introducing you to in a moment. Part of the reason we got interested in this, my friend and colleague Cindy and I, is because, as she mentioned, we have a number of graduate students in our programs, her program in nonprofit management and my program in bioethics here at Columbia, who are interested in working in health nonprofits and bring to health nonprofits important skills and insights, and many would like to work in this space. We have every year a number of students in our program who now work for the pharmaceutical industry, and some of them say, gee, I've worked in the pharmaceutical industry for a number of years, I've learned a lot, but I'd really like to be involved in a non-for-profit, to be involved in a patient advocacy organization. And students have said, you know, how would I do that? How would I even think about going about that? So we decided it would be great to have a panel that looks at some of these issues, some of the challenges, but also some suggestions on how to enter this space. What are some of the benefits of working in this space? What are some of the personal rewards, etc.? So to accomplish this, we've put together a great panel. I thought I'd first make a few introductory comments. We find in bioethics, as I said, people work in patient advocacy organizations, for hospitals, for educational institutions. They work for NGOs, non-governmental organizations, etc. They work for think tanks, as you'll hear about shortly. But at least in bioethics, most or many jobs in bioethics don't have the word bioethics in them. So people may get a job writing policy for the National Alzheimer's Foundation, as one of our students did, or they may work for the Medicare Rights Center, as you'll hear about. And what we find is that our students, because in bioethics, they're trained to try to understand perspectives of different stakeholders in healthcare, perspectives of different kinds of patients from diverse backgrounds, perspectives of physicians, perspectives from the pharmaceutical industry, from insurers, from hospitals, that they're able to negotiate and navigate and problem solve about challenges that come up in healthcare. And of course, there are many difficult issues in healthcare that come up. As Cindy mentioned, the COVID pandemic highlights many of these. Unfortunately, in many ways in healthcare, we just don't have enough resources to give everyone as much healthcare as they'd like. And so there are difficult ethical and policy questions and dilemmas that come up. And it's important to have people who are trained, as we train our students, to be able to address these and solve these problems. So we're going to be hearing from three people who are working in this space now. The first is going to be someone who is who's involved with the health nonprofit program for many years, and he has been the president and CEO of the Hearing Health Foundation and is faculty at Columbia NYU. Previously, he served as a senior division director at NYU Langone. He is a graduate of the NYU Wagner School of Service. Timothy, I'm delighted to have you join us. And I asked each speaker to talk about several things. First, how they got involved in the space, in the company, the area, the nonprofit that they're working in, what they like about it, what some of the rewards are, what some of the challenges are, what's happening in that area, in that field, what kind of trends it might be relevant to someone who's interested in entering the space. And lastly, what kind of suggestions would they have for someone interested in entering this area? What kind of other background, what kind of skills might they bring, et cetera. So first, Timothy Higdon, we're thrilled to have you with us, and welcome.
Thank you very much, and it's a pleasure to be with you tonight. The first thing that I'll say is that I love my job and I love the health sector, and there's not a lot of folks out there that have the ability to say they love their job, and and I'm very fortunate. So I started my professional career as an Army officer, and after 8 years, I left the Army to I went to work in medical sales, and that's where I really got fascinated by the biomedical industry and the healthcare industry. After 9/11, it radically, the trajectory changed my life, and I started doing nonprofit work. Most recently, I was at NYU Langone Health, where I was responsible for many of the areas in development other than major gifts. And I'm currently the CEO of the Hearing Health Foundation, and we are the largest private funder of research for finding cures for hearing loss and related conditions. And at the same time, I've had the privilege of being faculty at both Columbia and at NYU. One of the things that Dr. Klitzman asked me early on was things that I wish I knew. And so I divided this into a couple categories. The first is, what did I wish I knew personally? First of all, that in very large or very small organizations, you have to have passion for the mission and connection for the mission, or you won't likely succeed. And this is especially if you're in a development role or in a leadership role. It's just so important that you have the connection and the passion for the organization you're working for in order to be an effective fundraiser and to be an effective leader. The other thing that I would say personally that I wish I'd known is that, there's tons of smart people in the sector, and and there's always opportunity for new good leaders in this field, because this field and in healthcare is so diverse that having opportunities to lead is really great. The other thing that I would say on the personal note is, don't be afraid to take leadership roles early in your career as they're offered to you. I really resisted becoming the CEO until, a couple years ago. It was like 3 years ago. And this is the opportunity of a lifetime. And I wish that earlier in my career that I had taken that plunge and became the leader of the organization. Things I wish I'd known professionally. And these are more generic, but I think really important. And that is, the first thing is scale and scope of leadership. And so as you're taking opportunities, or as you're hiring people, if you're managing 2 or 3 people, the next step might be managing 4 or 5. But if you're managing 2 or 3 people, jumping to managing 30 or 40 people is likely an overstretch. And this is an area that I think that is important as you're structuring your career. The second thing that I'll tell you is that every career trajectory tells a story. And be careful of the story that you build to make sure that it makes sense and that it isn't a horror story. So a couple of things that I would say here is, don't be in too much of a hurry to get promoted. That as you get into these roles, it's important to take the time to learn the craft and become an expert at that level. That if you move too quickly, you'll later struggle for not having learned the business and learn the craft at that level. So the lesson here is not be in too much of a hurry to get promoted. The second thing is don't be a serial job jumper. And this means taking time and being very deliberate about the organizations you join, because one of the most deadly things in a career is when you look at a resume and somebody is 9 months in a year, 9 months in a job, a year in a job, and a year in a job, because organizations like mine and others are really looking for longevity. They're looking for people that will invest in spending their career or part of their career with an organization. So thinking in terms of, I want to be here 4 to 5 years, that is so important, because what people are looking for are you able to make commitments to an organization and stick with it? One of the most difficult things is having a huge churn in an organization where you have key people that are turning over every 12 or 18 months. And the next thing I'll say professionally is think 2 jobs from now. So think of where you want to be 7 to 10 years from now. So the next job that you take should be a natural stepping stone and training to get you ready for that next job. A couple other things that I'll share with you is take smart risks. So don't be risk averse, but be smart about it. So the organizations that you're thinking about, whether they're very small or whether they're, that they're very large, investigate the organizations. Look at their 990s, look at their audits, look at their, find out what other people are saying about the organization. And this is important. The second thing I will ask you, that it's important that you ask yourself, what do you want to be when you grow up? So if you are looking to be a CEO or an executive director of a health nonprofit, you want to look at jobs where you're more in generalist roles. And what I say, that it's an inch deep and a mile wide. So you're learning different aspects of the business, where if you're saying that I want to just do, I just want to do policy, then going into a large organization where that you can be hyper specialized, that where you're an inch wide and a mile deep could be advantageous to you. But it's important to think about where that you want to get, so that the next role and the next 2 roles that you take are natural stepping stones to get you there. A couple other things that I'll say here is the next thing is get educated. And I know I'm preaching to the choir because many of you are affiliated with Columbia, but take courses and degrees that make sense for your career objective. Be financially savvy. And when I say financially savvy, is make sure that when you leave Columbia, that you have basic financial acumen for nonprofits. Can you read basic financial statements? Because I've seen more leaders that stub their toe and fail because they don't understand the finances and they get themselves in trouble. I tell my grad students, in almost every other area of the business, you can stub your toe and live to see another day. If you mess up finance and you mess it up bad enough, you will not live to see the next day. Next thing that I'll say is continue to read, take courses, sharpen the saw. I'm 61 years old. I just finished a diversity, equity, and inclusion certificate at Georgetown. I'm taking another management program at Stanford Business School. It is so important to me and to my organization that we actually require every one of the people that are on our team to take a professional development opportunity, which we pay for, to make sure they're continuing to sharpen the saw and build the skills that they need. The last question is suggestions for entering the field. So the first thing that I would say is find your passion. Find something in this area that you're passionate about. For specific organizations such as mine, I have hearing loss. And so many of the people that are on our team have hearing loss, or someone directly related to them has hearing loss. So that having that personal connection to the health issue can be advantageous, both in having passion and connection, but also being able to open the door. Couple other things that I would say is network like crazy. Every job that I've gotten through networking. It's very rare that I've applied for a job and gone through the front door. It's been through networking and introductions that have been really important. And just as a note, many health organizations do not use headhunters. Many do not post their jobs. So what they're looking for is through networking and referrals, is how many people are introduced into these organizations. If you have a passion, consider volunteering in that organization or in a related organization so that you're able to demonstrate commitment to that specific health issue or to that area. A couple final things that I would say is that if you're a grad student, you have what I call as the golden ticket to Hollywood for you American Idol folks. And it's while you're in grad school, you can call or email many people and say, I'm a grad student, I'm gathering information. Would you be willing to have a 15-minute conversation with me? In that, many people will give you that time. Often that ticket vanishes when you graduate. So use that and make sure that you're talking with folks, networking into the organizations and to the sectors that you're interested in. A couple things on emerging trends. Diversity, equity, and inclusion is so present and front and center both in academia, with my coaching clients, and also at HHF. So it's very important that you get skilled and knowledgeable in what's happening in DEI. This is really changing the face of our sector. And for those that aren't skilled and knowledgeable of DEI, will not likely be leading organizations. They'll get left behind. So get smart on DEI, really important. Technology is changing very rapidly, and donors' expectations are continuing to increase. So it's important, that you continue to sharpen the saw. I love this sector. I love my job, and I would welcome you to seriously consider it. It's one where you'll meet really smart people, and at the end of the day, you'll know that you've made a difference.
Great. Well, thank you. Wow, that's amazing as a set of recommendations and suggestions and insights. So fabulous. And I hope people watching all took good notes. Next, we are delighted to have Derek Ayeh, who is a Senior Associate for Education and Policy at the Medicare Rights Center. He is a graduate of our Masters of Bioethics program here at Columbia, and his work centers around care integration and health system reform for vulnerable populations. So, Derek, welcome, and thank you for joining us.
Thank you for having me. And I'm really glad to actually be going after Timothy. There's something that he said there where he was talking about nonprofit management and how in the management section, you want to be, a mile wide and an inch deep. And I think I reflect the opposite thing that he said as well, it being the role that is a mile deep but an inch wide. So that felt kind of perfect. So I work at the Medicare Rights Center, which is a national nonprofit organization that works to ensure access to healthcare for older adults and people with disabilities. And I work there primarily doing policy and education work, as Bob said earlier. I've worked there for about 6 years now, and specifically, I do a lot of work with our New York policy team on issues related to people with Medicare and Medicaid, mental health advocacy, health system transformation, and a few other projects. So what I like about the nonprofit space is that it's enabled me to try on a few different hats throughout my 6 years of experience. So I started this job working directly with clients, answering questions, working on a helpline that we have. And over time, I was able to, using the bioethics master's degree that I have, show that, I have experience with research. I can easily work on policy related work. And so I've been able to transition and become part of multiple teams over my time at the Medicare Rights Center. And then among so the next thing, I know we were asked about what challenges we see working in this world or working in this space. And again, because I'm definitely like the mile deep in the policy work person, I think some of the challenges that I say will be very particular. But to try and talk more broadly about challenges working with nonprofits, my nonprofit itself is a much smaller organization. There are maybe about 30 people who work at the organization. So I can't say this applies to much larger nonprofits that sometimes have over like 70, 100 staff. But at mine, I've noticed that many of the times we have more projects than we have people. And so on the one hand, that can be sort of difficult, having to wear multiple hats, as I was always saying earlier, having to juggle between several different projects and sometimes not having the experience to tackle one or having more experience in another. But the great thing about that, and why I've been able to get into Medicare policy as I've been doing for the last couple of years, is because I've found that if you can show that you can successfully do the work that you're responsible for and also successfully wear a different hat, successfully transition and do some of the policy work, or maybe you're interested in the management stuff and being able to do that, a smaller nonprofit is really great because you have the opportunity to do more work, to get involved in different projects that you might not be able to if you're at a larger organization that sort of hires you to do one job. And maybe there's a very strict promotion process, such that if, say, you're hired as a grant writer, you're really only going to work in that department at a larger nonprofit. If, say, you were hired as a grant writer at a smaller nonprofit, you might be able to spin that and end up expanding your duties and finding yourself doing a job that fits better with your interests. So Bob was saying earlier that, especially for those of us who are bioethics students, one of the tricky things is that you're not going to find a lot of jobs that say, oh, like bioethicist at Medicare Rights Center or bioethicist at this hospital. Some of them exist, but for many of us, after you finish that degree, you're going to have to find out how to make your degree applicable to the work of other organizations, including many nonprofits. And so I've personally found that starting at an entry-level position at a small nonprofit where I knew that I would have opportunities to work on different projects enabled me to make a job that suits what my background is, what my experience is, what my interests are. And so I think that will be extremely useful, especially to many of you who are in the MS in Bioethics program, who maybe haven't worked a full-time job yet, or you're going to be trying to find a full-time job in the healthcare space. Let's see. Yeah, we were asked about suggestions as well. As I was saying before, I also graduated from the Columbia Bioethics program. So as far as levying the bioethics degree goes, I think a lot of people don't understand what your degree is. You'll see a lot of employers sort of nod their heads at it when you talk to them. And so you've got to figure out how to sell them on it, especially if you're entering the job market for the first time. I think if you've got an interest in healthcare policy work in any field, whether it's Medicare, Medicaid, insurance stuff like I do, or maybe you're more interested in hospitals, or maybe you're more interested in disease-specific nonprofit organizations, in any of those cases, I think the thing that potential employers will find most interesting is that MS bioethics students, as I've found, have considerable research skills that you gain through the program. I spoke a lot during my own interviews for jobs about how my master's taught me how to sift through complex articles, often taught me how to follow difficult language and nuanced positions in bioethical issues, and how I could apply that to other fields. So oftentimes in both my education and policy duties currently, I spend a lot of time going through legal documents, regulations, etc., and trying to distill that information, not only for consumer audiences, but often for my own colleagues, often for professional organizations that we work with or provide technical assistance to. And so all of that research experience that I have from the MS Bioethics program, I think became really useful in my current job and being able to work my way towards having having that job primarily be policy work. I'd also say that the writing skills that you obviously get through the program are extremely useful. you do a lot of essay writing in the MS program, as I remember it. And for me, that's turned into drafting comments, creating letters, writing policy papers, all of those things that my organization was able to trust that I had the competency to do because I had this master's degree that showed, oh, this is where my experience lies. This is how I've learned to do this, even if I haven't yet demonstrated it professionally.
That's great, Derek. Thank you. Fascinating and wonderful. And congratulations on all the amazing things you're doing. And interestingly, somewhat different from what Timothy said. I mean, sort of complementing each other.
Mm-hmm.
Next, we're delighted to have Robin Elliott. Robin was for many years the executive director of the Parkinson's Disease Foundation. He's had a 50-year career in healthcare and higher education, all of it in New York City. He grew up and was educated in England, as you'll hear from his accent in a moment. And he and I actually served on the New York State Stem Cell Commission. I had the privilege of working with him there. And Robin, thank you so much for joining us.
It's a great privilege. Thank you very much for inviting me. I love the first two presentations. They were very informative, and they saved me at least half of what I was going to say. From Higdon, I think the idea of passion, which he mentioned several times, is something which those of us who have spent so many years in this field, which I have, actually 50 years in total in education and health, passion is the central word and the guiding principle, and he obviously cares about that greatly. I like very much Derek Ayeh's comments about learning lots of things. You need to, in this field, in the nonprofit arena, it's not a one-shot, one-thing job. It's a many shots, many things job. And the idea of being able to have a general grounding, the kind of thing that obviously you get at a very fine graduate program at a place like Columbia, but also other professional training opportunities, is what you need to really be able to feel free to be your best in this very complicated but really powerfully important field. Few words about my own background. In those 50 years, I spent 3 years at Columbia, which I remember, even though they may want to forget it. I was in the School of Public Health for 3 years, doing work in the very, very, very early years of Medicare and the Defense Department program, which was for uniformed services, which was one of the big programs of the day. Following that, I was 10 years at Planned Parenthood, a very different area, a very exciting area of healthcare, where we went through the era of legalizing abortion and providing birth control services to unmarrieds, and a whole series of breakaway initiatives from the early days of Margaret Sanger 50 years earlier. And then after 18 years or so in the diaspora of education at Teachers College and at Hunter College at CUNY, I came back to healthcare and worked for 2 decades at Parkinson's as I was introduced, and finished up there as the CEO of the Parkinson's Disease Foundation. So it's a varied and interesting set of bird's eye views of healthcare in America, and how it's done, and how the education of the healthcare can feed the generations of people who come in to lead it. I have to say that not that I'm here to sell the idea of healthcare on you, though I'm told that there are people in this audience, many diverse people, from several people who are, I believe, medical doctors, but some who are on the early stages of their education, that if you need any education or any incentive to think about a career here, which I kind of doubt, continue not to doubt it. This is an amazingly important field. It's an amazingly interesting field. It's a field that America has not been, I have to say, quite as good at in an organized way as many European countries and others around the world, including socialist systems, which for better or worse have also favored healthcare in their priorities to a greater degree than America, where the capitalism, with all of its wonders and all of its faults, has let things happen as they will and develop as they must, and not in a very organized way. I've been engaged, because of my advanced age compared with my two companions on the panel. I've been engaged in the last 3 months in serious reminiscence about my career, and I've been looking at a whole swath of my past. And I look at the healthcare piece from the time that I was studying the 30s, the time at Columbia when I did a master's degree, and in my professional work in healthcare since, I was studying the Truman administration and their attempts to continue FDR's work unsuccessfully, to the LBJ, who managed magnificently with Medicare and Medicaid, Title 18, Title 19 of the Social Security Act, but never got any further, to Richard Nixon, who people think of in all kinds of ways. They often forget that he was a towering force. I think it's not unfair to say, a towering force in thinking about extending organized healthcare delivery to the people of America in an organized way. He failed for lots of reasons, but not for want of trying. To the Clintons, who memorably, not only through the president, his extraordinary partner in this enterprise, Hillary, who devoted must have been millions of hours to pulling together this very complicated system, and honorably failing, stress on honorably, but she did fail. And then, of course, to Obama, who did a magnificent job too, but never quite managed to bring the thing over the finishing line. The story of organizing healthcare in America and making it the special piece that it absolutely should be has been a very long and so far not definitive, successful, conclusive one. And so when I'm talking to people, like either 100 of you sign up for this, who are so talented, I saw a few of your resumes, or at least the sentences describing yourselves. And if anyone could look for a cadre of potential leaders in this extraordinary field, they're the people on this call today. And I compliment Bob and the other organizers of the session for putting you together. I cannot be sufficiently, forgive the expression, evangelical to suggest that your choice in thinking about this was the right one. And if we can help in some way to help you, guide you in ways you could find your way to this conclusion, we'd love to do it. I did parenthesis leave with the organizers of the event my email address and telephone number for if any of you want specific suggestions that may be helpful in the not the extracurricular, but non-degree program type professional training. Our speaker, Derek and Ayeh was talking about this at some length. And I would like to add to what he said and say that I could give you some suggestions on courses that I've either taken myself, having entered the field not as a health professional, but as a person very interested in health policy. And if you would like to follow through on that, I can give you a couple of leads there that are current and may be useful to you in pursuing your preparatory phase for the next field of your career. So do call me or email me on that one. I think that the only other thing to be said before we get to the much more important part of this session, which is hearing from you with your questions, is to say that this is a period in my 50 years of observing American healthcare, its ups and its downs, unfortunately more often its downs, I think to look at the response to COVID and the way that America and the organizations running healthcare in America responded to this. Not perfect, we all know, and you know as health professionals better certainly than I would. but it was a looking at the history of the way things are organized here. It was a wonderful connection between very serious scientific understanding and commitment from scientists and the people surrounding them, and the organizational mechanisms in delivery in the hospitals, medical schools, and industry itself, which is in America has a huge part of the burden and the responsibility for developing new medications. And to me, it's really quite fascinating, maybe obvious to all of you, that the four major new drugs that have been developed for this perfidious, terrible disease that we are afflicted with, almost a biblical style, fantastical plague. The three of the four were developed either in or by institutions in this country, industry working with universities, with scientists. Three of the four vaccines for COVID came through the United States and its instrumentalities. So even though I feel after these many years of not seeing healthcare organized the way it should be, that things could have gone faster, it is simply enthralling to see what has been done in so short of time to confront the most terrible challenge that humankind has ever faced. So we have reasons for modesty, but we have a couple of huge reasons for optimism. You're into a great field. You're doing a great thing. I'm delighted personally that you are doing so much serious yourself for this enterprise. And I hope that you'll call on the three of us as you need to for any guidance we can give to take you to the next stage.
Well, thank you, Robin. That was terrific. And thank you also for the historical perspectives and the international perspectives, which are very important for reminding us things we've done well, but also how much further we can go. That's terrific. Next, I'm delighted to introduce Cindy Lott, who you've already heard from. Cindy is a wonderful colleague. She's the director of the nonprofit management program. She's a graduate of Yale Law School. She's advised many nonprofits for many years, and we're thrilled to have her as a panelist. Cindy, I think you're on mute.
Thank you so much for that. And I have to say, it's amazing to listen to all of the stories. And I think I have a very different perspective on some of this, but I so appreciate, and I agree, the historical perspective is real as well. I thought I would drop my comments into kind of three buckets here. I would give a different perspective on how you can engage in the sector in a way that I have in this intersection of two sectors, really. I would talk a little bit about some of the skill sets because I think it's important, and we've heard some of them here tonight that you may want to be thinking about as you're thinking of through coursework or professional development that comes later. And I agree with Timothy, you always want to continue on that. I certainly still do. And then lastly, to really talk about how you get into it and what is out there right now. So walking back just a little bit. So I have not actually worked within a healthcare nonprofit myself in terms of being a paid employee, but that's actually part of my my spiel here tonight for you. I have advised many nonprofits over the years, many healthcare nonprofits as an attorney, both when I was in private practice, but also through academia and also through pro bono work that I've done. And I also say this coming as a community member. And it's an important part, I think, of my own interest in this. Something I've never even told Bob, but when I was in law school, I actually took a bioethics and law class from a premier professor who was both a doctor and a lawyer and had specialized for a very long time in this and actually been one of the original panel advisors on the Tuskegee studies ethics issues and panel therein for the U.S. government. And that was Dr. Jay Katz, RIP. So he was wonderful, and it really opened my eyes to a lot of issues in healthcare and how they would actually impact both the law and how the law impacts healthcare. So it isn't just about being a lawyer, because most of you will not be that, although you can certainly think about it. It's yet another intersection. But what it did for me is that it gave me a tool. And I think you've heard that some tonight. It helps to come to this process, whether you're going to be the mile wide, inch deep, or the opposite as Derek. It helps to know what it is that you bring to the table. And for me, I knew that I could manage things. I can make I can make chaos organized for many different things. I also had legal skills. I had writing skills. Communication skills are really important, as you've heard here tonight. But I also knew, apart from just passion, that I was willing to actually get in there and really look into the weeds and get into finances, get into fundraising, get into communications, and get into different ways of looking at healthcare issues to see how I could be most helpful. I often have told people that next to my 2 grown sons, the thing that I am most absolutely proud that I've created and been able to watch it grow up and walk away was a healthcare clinic for the uninsured in 2 counties that were the poorest counties in a state that I had lived in for a long time. And this is where I think I add a little bit of perspective to the panel tonight. I think it is imperative that you think about being a gap filler. No matter which perspective you come from, healthcare is constantly changing. It is one of the most changeable environments that we have. And COVID has only heightened that, as has the new and reinvigorated conversation around equity, DEI, and how healthcare actually reflects those inequities, how we think about communities and healthcare. It is involved in environmental justice. There is almost nothing that you can think of that does not have a healthcare component. So I urge you to think very, very broadly about this. When I knew that we did not have, this was before the ACA, before Obama got the ACA passed, which I was also involved in working with state attorneys general at the time as they were litigating the ACA. I was deep into that. I think having an interest in understanding what that meant on the ground for my community, even though I work at policy levels, which is what my research is in, I wanted to make sure that I actually was working in the trenches, even as a volunteer or a pro bono lawyer. And so I offered my services up to my community. And when you do that, they come and ask for them. They respond. And from that, we created a medical clinic that covered the uninsured in 2 of the poorest counties. And it took a lot. It took a lot of fundraising. It took a lot of communicating with local government. It took a lot of explaining to people why we needed it. And then years later, when the ACA came to pass, we had to explain why we still needed it. That even with the ACA, it was not going to be able to cover everybody, given various parameters. So that was yet another juncture for me. I also started a nonprofit legal clinic at another university, and one of the clients that we had was also a gap filler. He wanted to create a new system, which was new at the time, for electronic health records to be able to pass over what was actually a nonprofit platform. And it was interesting to me because I helped him file with the IRS and get his nonprofit status. We were one of the first successful healthcare records nonprofits in the country. And people seemed confused by this because they didn't understand that somebody wouldn't be trying to make a buck off of the electronic healthcare records system. And we really had to explain that this was a technological platform over which these records would pass, and that, in fact, nobody was making money off of it. It was a nonprofit. So always looking to see what you can bring to the table with the skills that you have or the ones that you're gaining at Columbia or will gain at Columbia if you're a prospective student, really, really important. It is always the case that you need passion. I agree with Timothy Higdon about this. You must have passion, and he is equally right. You must absolutely have some hard skills as well. It is not enough to have passion, especially in the healthcare field. One thing I also know is that my interests were abroad, and I recommend that to you as well. Think how it is that healthcare impacts communities. For me, when I very, very first ever started getting interested in the law, it actually came as a result of working in college with sexual assault survivors. And yes, those issues, those circumstances raise many, many issues, but one of the issues they raise is around healthcare. I was very interested in technology and privacy. That fits very nicely in healthcare as well. So lots and lots of ways that you can enter these conversations. Speaking about the intersection of these 2 fields, I often say that people back into the nonprofit sector one of 2 ways. They either They either are impassioned about a particular issue. In this case, it may be some form of healthcare issue for you. And then they decide they want to do that they want to deploy those interests and those skill sets within a nonprofit context, which, as I said earlier, is a huge part of our healthcare system in the United States. The other way is that people are already in the nonprofit sector, and then they realize that what they really want to do is work within the medical context. We have a lot of students who actually come to our program who are already working in fundraising and development within a university center for research, or within some other form of a healthcare organization. You heard Timothy talk about his time doing that. That's a very popular option, but it's certainly not the only one. So whichever way you've backed into this intersection of these two fields, I couldn't agree more. Right now is the time to be entrepreneurial. That's really where I've most felt that I have added value to this particular world. And it's not as a paid employee most of the time. It's either doing advising or it's helping through pro bono. But I am helping entrepreneurs. Either I'm helping gap fill myself with colleagues, or I am helping other people who have observed a gap. And we are seeing through COVID and through these equity conversations that are top of mind right now in the US and internationally, we are seeing and will continue to see many of you who are thinking of new things that need to exist, that the old ways. Healthcare is a tough go because it's so massive and it has so many different voices that trying to enter the space and make change can be difficult. But I am absolutely convinced that we have generations coming up right now that are going to do that. I will also add that another skill set I think you have to have is some understanding, some acumen with technology, and also the ability to not be scared of data. There's nothing that you can do these days in healthcare that is not going to involve data. So just like understanding financial management, if you're going to be in a leadership position, no matter where you sit in the organization or where you sit, if you're trying to make the case for something new and entrepreneurial, you are going to have data to be able to show why it's needed. And you'll have to have it eventually for metrics and program evaluation and assessment. So I highly recommend that you take something in that area as you were thinking through your coursework, no matter which program or which side, which perspective that you have. So I think that this area is just rife with all sorts of possibilities on the entrepreneurial front. And that's really where I am most interested. I'm happy to speak with anybody about this. It has been a lifelong interest of mine professionally and personally. I've also been part of a research study, and I think it's amazing to be a participant in many different ways at this intersection. And I'm just thrilled to be here with colleagues that feel similarly and attendees in the audience. So with that, I'll pass it back to Bob, and we'll get right to questions.
Great. Well, thank you, Cindy. That was terrific. And I think you hear the passion that comes through everyone. I just want to make a few quick announcements. One, please ask questions in the chat there, and we've gotten some, and we'll be answering those, addressing those in a moment. And secondly, just to follow up on what Robin said, we will be sending out to those of you who registered an email with various resources on it that can get you started. And again, also check out our websites. We have lots of free resources on our respective websites, the Bioethics program and the Nonprofit Management program. So here's a question from the audience. Networking was mentioned often. How would you recommend to go about networking? And if I can just add, especially in the age of COVID, where things are more online and maybe there aren't sort of the large professional meetings as there used to be. So maybe Timothy, do you want to start with that? And then whoever wants to jump in?
Sure. So first of all, I'll address the question philosophically, and then the mechanics of how to do it. So philosophically, when you think about networking, there's two different types of ties. There's strong ties and weak ties. And naturally, most people would think, I want to talk to people with strong ties and not weak ties. So as you're thinking about your networking, if you're going to your fraternity brothers or to the people that you are, your classmates that you're very close to, the amount of overlap is very high. So incremental people for you to meet is very low. So as you're thinking about your networking plan, think about the weak ties. So think about asking and trying to network into places where there's not a high degree of overlap, because that's where you really begin to open up a lot more broad possibilities. But if you're trying to network within closed groups where everybody pretty much knows the same people, it's really hard to really get the lift that you need. So I'll talk about what I think are the mechanics of it. First of all, with Zoom or with COVID, it has made it more challenging, but not impossible. The first thing that I would recommend is that if you don't have a LinkedIn account, you should absolutely have because that's a great way for you to stay connected with people, for them to know what you're doing. When you request a meeting with someone, and that can either be, when you reach out to somebody to say, could I get 15 minutes or 20 minutes of your time? We could do it by Zoom. Or if you feel comfortable, maybe we can meet for a coffee outside. I have found that over the last 6 months, at least in New York City, where people in the late spring were absolutely no meetings, everything had to be by Zoom, that it started migrating to where people would meet outside. And now folks are willing, some people will meet outside, some people are willing to go inside, some people are Zoom only. So you have to be a little bit flexible on that. The last thing I'll say on networking is that when you prepare for that opportunity, prepare diligently for it. So make sure that you've researched the person and the organization that you're talking to. Have very specific questions. The worst thing that can happen is to go in and say, well, I don't really know what to do, so can you tell me what to do? That's really the wrong approach. So be very specific in the questions and the things that you want. And the final thing that I would say is, at the end of the conversation, ask the person, is there anything that I can do to be helpful to you? Most of the time it'll be no, but it could be, we're really looking, we have, an entry-level position that we're looking to fill, or I'm looking for, this, or would you have an idea about that? So, but what it does is it looks like that you're willing to bring value to the table. It's all about me, give me, but it's really a partnership. And the final thing I would say is follow up with the person after you've had a meeting. Handwritten thank you note is really fantastic. It's my secret weapon. I literally write cards and send to people. And but whether it's email, but make sure that you do follow up and thank people. Connect with them on LinkedIn so that they can stay apprised of where you're at. The good thing is that people may not have a specific idea at the moment, but that conversation, you've planted seeds in their mind that if a headhunter or someone down the road say, I had a conversation with a person, I think that they might be a great fit for you. So this can be really good. So first of all, think strong ties or weak ties. The weak ties are better for networking. Think about the mechanics of how you do it. Be very specific when you go in for what you want to accomplish. Thank them. Ask them what you can do to be helpful. And I think that that should do the trick for you.
That's great. Wonderful comments. Cindy, do you have thoughts on that?
Yeah, I really agree with Timothy. And there are actually studies that show that weak ties will get you where you want to go in terms of new connections better than strong ties. So I'm with that. I would say one thing that's I've seen specific in my world, now that I've lived in the world of law and I've lived in the world of nonprofits, I find that a lot of people that are very mission-based and nonprofit minded often feel that networking is kind of some dirty practice that they're supposed to stay away from, and that it somehow, is too schmarmy and somehow like we're not supposed to do that. I urge you, not unlike what Timothy said, I urge you to think about it differently. I urge you to think about the fact that you'll also come, as I said before, to the table with some skills. I think especially when you're looking at the intersection of two fields, going and asking people their thoughts and advice. Almost everybody likes to be asked for advice, right? And they like to tell the story of their career. That's a really easy way to ask people and say, how did you get where you are? Much of the types of questions that people are answering here on the panel tonight. What do you wish you'd known? This, and send your CV in advance, just always not in an assuming way, but in case this is helpful way. You send something if you can. Now, if you're doing it through LinkedIn, you've already seen each other's, backgrounds, right? And I agree that it's important to not feel like it is only a one-way street. You are offering something here as well if you could be useful to them. And there is nothing wrong with networking. It is the way people get to know information. And informational interviews are real. And telling people that so it's clear you're not asking for a job, that's where people shy away from wanting to meet with folks, as if they feel like it's a subterfuge for being asked for a job. Instead, say, this is only an informational interview. I am just very curious how you got where you are, and if you might have some advice as I start doing this, given my background in X or Y. Being that clear about it is really, really helpful and will make people feel like they're not being put on the spot to meet you or to talk with you.
Great comments. Here's a related question. Someone in the audience wrote, I'm a STEM scientist. Robin, do you want to comment? Or did someone want to comment?
I just had a quick thing to add to those two, if I may.
Please. Yes, please.
I think we talked about learning, and since many people coming in our group today are going into this field maybe for the first time. They've been doing other things like being doctors and nurses and so forth. They're coming into this for the first time, into the nonprofit area generally, and they were looking for learning opportunities. Learning opportunities themselves are wonderful networking opportunities. When you go to a meeting at the Association of Fundraising Professionals, the Certified Fundraising Executives, the Nonprofit Learning Lab, Nonprofit Ready, there are a ton of organizations like this. If you go and do for education field, you will find yourself in the company not only of people looking for jobs like you, but also in the faculty, people who can help you make the connections. I found in my own career that being in those kinds of places is a heck of a lot more productive than scanning the want ads.
Wise words, thank you. So a related question from the audience. I'm a STEM scientist, science, technology, engineering, math, looking into nonprofits. Do you recommend I form connections before I apply? Anyone want to take a comment on that? Offer a comment? Timothy, go ahead.
Yeah, I would say that that this should be, could be a really great part of your inquiry before, you're looking, at the possibility of nonprofits. So asking people questions about, well, what's it like to work in a nonprofit? And especially if you can find scientists that have made the leap from either from government and industry into nonprofit to say, I'm considering a career change. It's probably one of the more common informational meetings that I take is, people that I'm in the private sector and I'm thinking about wanting to go into a nonprofit. And that's a really common thing, really common approach. But I would really view that this is it would be a fantastic learning opportunity to say, what is it that I'm going into so that you can make an informed decision.
That's great. Others want to jump in?
I would add to that for STEM folks, especially because it depends on which kind of work within STEM you're doing, obviously. But one of the areas around healthcare nonprofits that's burgeoning and that they need hard science skills is in the advocacy space. So this has become huge, and it's only going to become bigger with equity concerns and underrepresented populations and thinking about how we do science. How we translate science, which has become part of obviously federal conversations for policy. So advocacy organizations are another area that actually use a lot of data and science in doing their work. I think all of those types of networking, and I agree with Timothy that saying, I'm thinking about doing X, have you worked with people that have this mix of skill sets? Do you wish there were people that had this mix of skill sets? Those are the kinds of questions I would ask when you do informational interviews.
That's great. Derek, Robin, any thoughts on that? Someone from STEM?
Well said. Well said.
So Cindy, one thought I had as you're talking is, I wonder if you could name, not everyone may, when you say advocacy organizations, people may be thinking different things. Somebody, could you name some advocacy organizations, and maybe for the others, if you were to say, obviously someone's going to be judged dependent on someone's own passion. What are various kinds of nonprofits you think are good nonprofits out there that are worth thinking about that may not be on people's radar as much as they should be?
Yeah, well, Timothy works at one that may do advocacy. I'm not sure if you guys do advocacy or not. There are splits. There are legal, constraints around certain nonprofits doing advocacy. But any of your major, Girl Scouts of the USA, the person that leads policy teaches in our program, for example. Planned Parenthood is a very well-known one, right? you pick your issue. It could be anything around, as I said, environmental justice. You could have everything from anybody that's involved in any equity space is bound to have an advocacy arm to them, a legal arm that they are allowed to do advocacy. So it could be any representation of any underrepresented group. They all have different advocacy organizations. It could be a gender split. It could be transgender issues. It could be anything that's out in communities. Name, slice and dice any part of your community. There's an advocacy organization that's out there for that deals somehow with healthcare, right? And so some of them are national. And that's another thing to think about, is that you also want to think, am I interested in local work? Am I interested in work that's only within one particular, tri-state area, for example, an urban environment that really concerns you? We have tons of issues in the rural communities, in the Native American communities. We have all sorts of advocacy groups that do that. And then, of course, that doesn't even touch the international scope. So figuring out where you're comfortable thinking about working or coordinating with different, even if you work in New York, but you're coordinating with somebody, in Geneva on these same issues, thinking about that also and looking for networking on that as well. So I'm on the spot and I probably should be able to articulate this better, but there's so many different advocacy groups and they're all publicly listed because there are tax exempt organizations. The IRS lists every single organization that has tax exempt status publicly.
Timothy, go ahead. And then Derek.
Yeah, the other thing that I would say, and Cindy touched on it, and it goes back to passion. Find the area that you're passionate about, and then there can be very small organizations that might be in just a borough in Manhattan that's doing this level of advocacy, all the way to international organizations. And as you're doing your networking, it's important to ask the people, like, what's the environment that you work in? What's the resource constraints you have? Because if you're coming from government or a big pharma and you're going to go into a smaller organization, there are a lot of cultural differences. One might be the amount of resources that are available. One of the good things that might happen is how much latitude and freedom that you have to actually do something, where in a large organization, it could be more structured. So as you're thinking about this, not only thinking about where you're passionate, but I would also encourage you to investigate organizations that are small, medium, and large, so you really understand what's the landscape and in the environment that they work in. And ask yourself, could I see myself happily operating in that in that landscape? And I think that will give you a lot of insight as you're looking at different organizations.
That's great. Derek?
Yeah, I just wanted to say, as far on the top of my head, organizations that came to mind: Healthcare for All New York, Community Service Society, legal aid societies, or like New York Legal Aid, CHAMP, which is a mental health organization in New York. And these are just New York specific advocacy organizations. So to both Cindy and Timothy's points, the amount of organizations that exist out there is massive. And so really it should be making those decisions about, do you want to work locally? Do you want to work nationally? And then looking into what organizations already exist that maybe have a mission that fit your sort of goals.
Robin, any thoughts? Ted? Okay. Cindy, you mentioned the IRS as a list. Is there one list somewhere? You just sort of Google things and it pops up?
Yeah, you can. You can always find the official files for, if you're looking for a specific organization, you can go find out a lot of information about it by going to different websites that have all of the, what we call the 990 information, which is the annual return that they have to file as tax exempt, since they're not filing taxes, most of them, although some of them are as well. So there is a list like that where you can actually look up to see what's what. Now, I'm not positive you can search it through looking, I want to look at everything that deals with Veterans Affairs, for example, which is a huge area of growth, by the way. But you can, the internet is your friend. There's almost nothing not discoverable these days. If anything, you can almost find things that are so niche-y that you need to make sure that they're actually, there are lots of nonprofits that have very, very few resources. And before you dive into one, you will want to actually look at their finances, right, which are available online.
Okay, so here's another question from the audience. As an undergraduate student studying bioethics, what recommendations would you have in regards to internships and entry-level job opportunities to gain a deeper insight of the field before graduate school? And maybe just internships more broadly. Any comments on internships or how to find them, recommendations about them?
Yeah, sure. I can start with that one. As far as bioethics related internships, the first thought that comes to mind is looking at like the National Institutes for Health, or looking at organizations like Mayo Clinic or NYU, or places that have bioethics programs of some sort. A lot of institutional review boards happen to hire bioethicists and things like that, and maybe have internships. But I think talking about it more broadly, it should really just be looking at organizations that you might be interested in, organizations that have work or research that you find fascinating, and then going to their website and seeing whether or not there are internships available there. Sometimes even finding out whether or not, if there's a particular researcher that you're interested in, maybe there's a volunteer opportunity if you're able to do volunteer opportunity over working paid. But yeah, I'll leave it at that.
Great. And we have a few of the panelists typed in the chat, I'll just say, in terms of lists of foundations and places, lists of nonprofits. There's the Robert Wood Johnson Foundation Fund, right? Robert Wood Johnson Foundation, I've gotten funding from them, but they do a lot of wonderful work. Idealist.org lists a lot of not-for-profit jobs and positions. GuideStar.org. GuideStar.org is a free site where one can get access to all 990 forms, tax returns for nonprofits, which is great. So getting back to internships. So how would I find an internship? Do I just Google internship? Timothy, go ahead.
Internships are tough, and partly because you want to be a good consumer of finding the right internship, and so and they're very competitive. So when you're thinking about internships, it's first of all, look at organizations where that you have a passion. This is a common theme. Consider volunteering, and maybe that could morph into a internship. A lot of times with internships, and this goes back to DEI and privilege and access, is that oftentimes they're kind of kept in the vest, where they're, that their internships can be given to, I have a board member that has a kid, blah, 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 blah. So it takes some diligence and networking to do that. The best kind of internships are paid internships. If you're going to do an internship that is unpaid, and I'd say this with any internship, but especially if it's unpaid, make sure that you're getting value out of it. Because if you go and you're sitting around and not doing anything, or they're having you, run for coffee and you're not really getting value, that's not helpful to you. So, and what I would also say is start early. That, the really the networking and trying to get the internships, because it's very competitive, because a lot of folks are looking at that as a way to get a leg up into getting into top grad schools or into top undergrad programs. So it's a very competitive environment. At my foundation, I set a policy in place is that we don't do unpaid internships anymore. If we're going to have internships, we pay, because I think it's a fairness thing. If somebody's coming and working, then they should be paid. So I think that's something to think about, but it's a longer process. It's a networking, and make sure that you're getting value out of that. And then when you get the internship, really overperform. I mean, give it 150%, because in many organizations I've been, internships are the pool for where people are permanently hired. So if you go and do a great job, you've had an audition, and organizations are much more apt to hire you if you've worked out well than if you haven't.
Great, well said. Others, Cindy, do you want to make a comment? And then Robin?
I do. I have one general comment that could be made for any field that you're doing, looking for an internship, and then one very specific to this. So there is no such thing as a wasted interview or a wasted internship if you actually take a true lesson from it one way or the other. Sometimes it'll be a negative example in your life. That's true for jobs as well, right? So make the most of getting out there and practicing interviewing. I'm talking more to the younger folks here, or people in the undergrad world that may not have work experience yet. Do all of it. And volunteering is the same way. You get to put that on your resume, but don't make the fatal mistake of overblowing what you were doing there if you put it on your resume, because eventually that can really come back. And if you've lost your street cred just when they figured out that you didn't do what was on your CV in any real way, don't make it sound like you did more than you did. I agree with Timothy that you need to be a careful consumer. The piece of advice I give anybody about any internship or job or even volunteer experience is that you should already have in your head what you are going to put on your CV, on your resume about that position before you even start. There should be some reason why you're there and what it is that you're expecting to get out of it. I also remind people that when you are working with an employer, you are helping solve a problem for them. You are not supposed to be the problem. I have overseen many interns in my many years, and some interns, frankly, are more trouble than they're worth because it's all about them. So you're helping solve a problem for them, and you need to be really pitching in, as Timothy said, as much as you possibly can, and know why you're there. And it's okay to have some asks of them and ask for mentoring. When you do an internship, if you don't get anything else out of it, at least ask for some mentoring. The other good reason to do internships and to interview for positions and internships, you never know where the people you're interviewing with are going to wind up. You might not get that position, but they may literally be on their way out the door and 2 weeks later call you because they suddenly need help in a new position. You have no idea what the internal mechanisms are that are going on in that organization. So just do your best, get yourself out there. Specific to our field, if you are interested, especially as a younger person, in a particular geography, say you're going to be somewhere in between semesters, go to your community foundation. Every area of the country has one, or more than one. Community foundations are the pool of money that is collected through donations in that community and then is dispersed to a ton of nonprofits that do different work, usually human services work. But those lists exist on the website for a specific community foundation, and you can get an amazing array of ideas of where you could do an internship in the healthcare field through your community foundation list.
Great. Robin, you want to make a comment?
Yeah, I would add something to that. I must say I'm a bit down on this. I think the nonprofit field is wonderful at many things. I think it's terrible in this area. I was thinking, as the others were speaking, about my own field, my own experience. I don't remember any organization I've been attached to that has done a very good job with internships. Most of them don't. The professionals are too busy and too occupied, and they're not very good teachers anyway, most of them, so they don't do it. And so I think it would be wonderful if we had this. It's very hard to find. What I would recommend to this person is, which is not a huge compensation, but maybe an alternative, is rather than look for internships, which are very hard to find, look to volunteer, look to get on a committee of a neighborhood or not so neighborhoody group that is looking for can be used, and you're not getting paid, but you're not getting paid much in an internship anyway, and get in that way. If you want to learn about the organization, try and do it initially through volunteer status, rather than worrying about whether you get an internship that mostly, I'm afraid, sadly, is not going to be available.
Great suggestion. Other comments on that? Now we'll go to the next question. And Cindy wrote, most cities maintain a list of volunteer opportunities and/or local United Way does. Thank you. Another question from the audience, how important are terminal degrees in staying competitive? Also, how important are fellowships? So terminal degrees, I'll just say, I think I find with our master's degree that, as Derek was saying, and I think Cindy would say as well, that with master's degree students do very well getting jobs in nonprofits, and particularly from a place like Columbia. And I should say also, we have an IRB internship that's been very successful in people in getting jobs in IRBs, et cetera. So part of the reason why I think we're jointly having this is because we're very committed to helping our students get jobs and positions, et cetera, and seeking advice and networking, et cetera. But so thoughts on terminal degrees, staying competitive, and fellowships? Timothy, go ahead. and then Robin.
Yeah, so the question that you want to ask yourself is, what do you want to be when you grow up? And I mean, I say this kind of facetiously, and but if you have intentions of being a senior leader in a nonprofit organization, an advanced degree, especially like a nonprofit management degree, is really very helpful. The skills that you get, particularly around policy, around leadership, around financial management, understanding ethics and board governance, these really essential things that you really need to know in order to be an effective leader are really important. You'll also find that for many of the leadership roles, the organization would say an advanced degree is desired. And so it may not be required, but it becomes a distinguishing point as to whether whether you're considered or as strongly considered. But I would say that if you're thinking about being like a senior development director or an executive director or a CEO or running a policy institute, that the master's degree is essential, and getting those specific skill sets is really is super important so that you're able to be successful.
Great. Robin, thoughts?
Take on Timothy's point. I think what he said is very wise. But I think there are different kinds of opportunities where the field requires a certain kind of preparation and endorsement by authorities, the most obvious being obviously law and medicine. The degree is absolutely essential. You can't muddle your way into a job in those fields, senior job, without having the credential. In other areas, in my experience, it's much less necessary. And I had a story from I was 24 years old, going for my second job. And I brandished my BA from a major British university, my master's degree from a major American university. And the fellow brushed them aside and said, forget that. What did you do in that first job? I think for many of the jobs that don't require the credentials that medicine and law and finance and some other things require, it's really more important that you have a good presentation, a good experience, and know back to the general education things. That's more important than it is to have the credentials. So I wouldn't obsess. Important though it is to have some of those other credentials that Timothy was talking about, I don't think they're essential to the job the same way that law and medicine are.
Cindy, Derek, any comments? Cindy wrote in the chat, terminal versus advanced versus licensure, important distinctions. Our program, nonprofit management, is new, as is bioethics. So I think, as Derek was saying, sometimes we have to inform employers what those degrees provide in terms of skills and insights and abilities in terms of problem solving and some things we've been saying. Other thoughts on that? How about trends? I mean, we heard about COVID being obviously, Cindy mentioned Veterans Affairs. I think aging is another area that's increasing. Do you see other kinds of changes in areas, or of course technology?
Sure, I can start to answer this, and others can obviously chime in. I think the first thought that comes immediately to mind is telehealth as becoming quite a new, there's a new renewed focus on telehealth, and that's as well a result of the COVID-19 pandemic. Just so much telehealth had to be given out, and so there are a lot of organizations that are looking into it. There's even among my own organization and looking into Medicare, like Medicare itself and Medicaid have been changing a lot of how telehealth is covered and trying to expand coverage for it. And so I think there's a lot of interest in that. I would say other trends, and this sort of was a comment that I was thinking about earlier as well. A lot of work, at least in my experience around working in a nonprofit, is very determined by whatever is of interest to people currently. So oftentimes whatever is most politically interesting. So For example, for us right now, there's a lot of energy around Medicare receiving dental care. And so a lot of our work happens to move with whatever trend is in the vogue, is in the news. But I think I'll let others answer as well.
Okay. Other thoughts?
Go ahead, Timothy. Oh, wait.
Go ahead, Cindy. I could go after.
So I think there are a few other areas. I do think veterans, big issue. I think anything dealing with underrepresented communities, which is where I think, as I said, if you have facility with data, with numbers, with number crunching, some around technology, I think it's really important. I agree that aging is a huge area. I do think environmental justice bleeds right into, for lack of a better term there, right into healthcare issues. I mean, look at the Flint water crisis. It's just a little microcosm of huge, major issues. And of course, it was major in that community. But I mean, who would have thought that one city's issue would really bring to light so many others in terms of this intersection that we're talking about here, right? I also think one of the other major areas is mental health. We're finally coming to grips with how much mental health really impacts people's daily lives, and everything from families and parenting to work relationships to longevity to, as we've seen with COVID, aging and loneliness and all sorts of issues that we're seeing just happen at every single phase. And the last area, I think, is around gender identity. I think we are seeing more and more, and again, that is also with advocacy, but also just a lot more about, we need more information about new areas that are really, they're not new in society, but they're new in their recognition, and then moving that into policy. I think is one of the other big mechanisms that we're seeing in various areas that involve some of the STEM fields.
That's great. Timothy?
Yeah, this is more of an area that I think that we're going to start to see some consolidation, because if you look at the number of new nonprofits that are starting every year, it's staggering that the number of nonprofits and new ones that start every year, and those that don't survive. And so I think as you're doing your investigation of organizations, one of the first things to do is go pull that 990, look at the front page of it, and see what kind of resources they have, what's their expenditure on program, because I'm seeing it in the health, I'm in the otology area, which is primarily around hearing research, and there's so many organizations out there that are giving tiny grants. And so what we're starting to do is say, how can we partner? How can we consolidate in order not to have duplication of services, duplications of grants, and duplication of overhead? So I think that is one of the things that's going to, I think we're really at the beginning of, but I think there's going to be a shakeout in the sector where smaller nonprofits are going to really be forced to consolidate.
Cindy, do you want to add something?
Well, it's not on that point, but it's on the list of things that I don't disagree with that. And actually, every recession brings consolidation also. So we see the death of nonprofits, which is not a terrible thing if they're not functioning well, but also the consolidation of mergers. So I do agree with that. The other area just occurred to me that I wanted to mention previously, and again, on my theory that you need to think broadly, not just with your passion, but in what you bring to the table, is also around issues regarding violence. So I do think that we are seeing an uptick in needing, again, data and medical understanding of things like gun violence, of the combo of mental health and self-violence in suicide prevention. We are seeing some of those really come to pass. And I give as an example, many years ago, those of you in the medical field know this, Johns Hopkins was one of the first, if not the first university to offer a dual degree with its law school. And they did a lot of work on gun violence. And those types of social issues always have this component of health, and also have a component of needing nonprofits and advocacy in communities and also in policy. So thinking about things that way, how do I get into an issue? And then looking at all the stakeholders and the players within that issue. Pick up your local paper and you're going to see these issues pop out if you're looking for them.
Great. So we just have a few minutes left, and in a moment, I'm going to ask all the panelists if they have a final comment or question or thought. But I see Timothy wrote in the chat also, it's an investment in yourself and your career. Do you want to maybe elaborate on that?
Sure. And this was back to the pursuing the advanced degree. And what I would recommend is that I'm a real advocate of the advanced degree if it is in line with what your career trajectory and objectives are. A couple other things to think about is that once that you have the advanced degree, or maybe the advanced degree may not be the right thing for you, is think in terms of certificates or courses or other things. So, if there's a narrow piece of knowledge that you want to gain. So like for me, I wanted to learn more about DEI. So I signed up to and took this DEI certificate course, which was a 6-month course. Or it may be that you're more interested in nonprofit finance, or you are interested in advocacy around a certain area. There are everything from seminars that are, a couple hours up to week-long courses. But what I would say is whatever you do is continually invest in your career, because what you learn today will be obsolete, 5 or 10 years down the road. So you've got to continue to reinvent yourself. You've got to continue to re-educate yourself. And as Stephen Covey used to say, is you got to continue to sharpen the saw. This is really an essential component, regardless of the direction that you want to go, is continue to invest in your education.
That's great. Thank you. And I should say that our program, I think Cindy's more familiar with the bioethics one, we have individual courses, certificates that students can take, as well as a degree, et cetera. So we just have a minute left, really, but any final thoughts? This has been a fabulous panel. Robin, go ahead.
This has been said by a couple of the folks, but it wasn't on my list at the beginning, and it should have been. I think that I have found in my many years of career, a number of times, maybe dozens of times, people of some talent would call me and simply say, I'm thinking of getting into this field. I really don't know if you have any jobs. Could you give me 15, 20 minutes of time just to chat about what goes on and what might be the opportunities? Much more often than not, I said yes. When I did this, I had a great time. I think maybe I helped, but it struck me in terms of this conversation we're having this evening that I cannot think of a better way for somebody to break in creatively than not to just look at the job listings, not to just go to the seminars, but to simply find opportunities to speak to people in fields that you have an interest in and say, could I speak to you for a few minutes just to find out whether there's something there, whether there could be there that I could be connected with. You're not putting them on the spot. There's no job open that you're applying for. You're simply making yourself known, and you're learning on the process. And the person you're talking to, if they're anything like the way I was in these conversations, gets a great deal out of the conversation too.
Great. Well, unfortunately, we're out of time, but I think that's a great note to end on. So I want to thank all the panelists for a fabulous job. I mean, what insight and wisdom and the experiences you've all had have been great. And thank you so much for sharing them. I really want to thank all the people who attended tonight. Thank you for your questions. We will be, to let you know, we'll be sending out some resources via email. This video, it will also be on YouTube, and we'll send you a link to that. Please do check out our programs, our websites. We have also lots of other videos of other career panels and other events and resources that you might find of interest. And I want to thank the organizers, all the behind the scenes folks, Karen Schimmel and Peter and their team. So thank you, and Samir Lada, who helped with the questions. So thank you all very much, and have a great evening, and we look forward to being in touch. So long, everyone. Thank you.